Okay, get this. Would you believe that in some cases, patients actually preferred getting medical message responses drafted by artificial intelligence? Like, more than ones written by a human doctor or nurse?
Yeah, it sounds pretty surprising when you first hear it, doesn't it?
It really does. So yeah, let's dive into this because it kind of flips expectations.
Absolutely. This deep dive is all about a recent study looking into exactly that, how patients feel about AI drafting responses to their messages in, those patient portals we all use now.
Okay, so what was the spark? Why look into this now? Was it just academic curiosity or something bigger?
It was definitely something bigger. The main driver is this growing problem of clinician burnout.
Right. We hear a lot about that.
Exactly. Doctors, nurses, they're just getting overwhelmed by the sheer volume of messages through these portals. It adds a ton of administrative work.
Makes sense.
So AI is being looked at as maybe a potential tool to help ease that burden. Drafting responses, freeing up clinician time.
Okay, so AI drafts it, the clinician reviews, and sends it, saving time. I can see the appeal for the healthcare side.
Precisely. But the huge question the study wanted to tackle was, well, how do patients feel about that? Are they okay with AI getting involved in their medical communication?
Yeah, that's the crucial part, isn't it? Patient perspective. So how did they figure this out?
Well, the researchers used a survey. It was conducted within the Duke University Health System, specifically with their patient advisory committee.
Oh, interesting. So people already kind of engaged in giving feedback.
Exactly. These are folks over 18 who participate in surveys to help improve the health system. So they're likely quite thoughtful about their care. The survey ran, between October 31st and December 11th, 2023.
Okay, pretty recent then. What kinds of things were they asked to rate or consider?
They looked at message responses and asked participants to rate things like overall satisfaction, how useful the information felt, and the level of care they perceived, all on a 5-point scale. And the survey varied a few things.
Ooh.
Who wrote the draft, AI or a human, and crucially, whether the patient was told who wrote it. Like, was it disclosed as AI, disclosed as human, or no disclosure at all?
Ah, the disclosure angle. That seems important. Did they look at different medical topics too?
They did consider topic seriousness, yeah. But the really surprising finding we started with wasn't primarily tied to how serious the topic was. It was more about the author and the disclosure.
Got it. So did a lot of people respond to this survey?
They actually got a really good response rate. Out of about 2,500 members invited, 1,455 responded. That's nearly 58%.
Wow, that's high for a survey.
It is, and they noted the demographics of the respondents tended to be a bit older, more educated, and mostly female compared to the whole committee. Good context to keep in mind.
Definitely. Okay, so the big reveal, what was this surprising result that jumped out?
Okay, so here's the kicker. Overall, participants actually showed a preference for the responses drafted by AI compared to the human written ones.
Wait, what? They preferred the AI.
Seriously. Looking at the numbers, the average satisfaction score was 0.30 points higher for AI drafts on that 5-point scale.
It's not huge, but it's measurable.
It's statistically significant, yeah.
Yeah.
And they saw similar small bumps for usefulness and perceived care with the AI drafts, too.
Huh. Why do you think that might be? Were the AI responses just clearer, faster, more direct?
That's the million-dollar question, isn't it?
Yeah.
The study doesn't definitively say why, but we can speculate.
Right.
Maybe the AI responses were perceived as more straightforward,
Mm-hmm.
perhaps more consistently concise, getting right to the point without, the potential ambiguity that sometimes creeps into human writing.
Yeah, I could see that. Less bedside manner, maybe, but more direct information.
Possibly. Or maybe just perceived as more purely informational. But it's also really important to stress satisfaction was still high overall for both types of responses. We're talking over 75% satisfaction regardless of the author.
Okay, that's key. It's not like people hated the human responses.
Not at all. It was a slight preference toward AI initially.
Okay, initially. You mentioned something about disclosure throwing a wrench in things.
Yes, exactly. This is where the nuance comes in.
Yeah.
That preference for AI, it flipped when patients were explicitly told this response was drafted by AI.
Ah, so knowing it was AI made them like it less.
Pretty much. Satisfaction actually decreased in that scenario.
How much less satisfied were they?
Well, compared to when they were told a human wrote it, satisfaction was 0.13 points lower when AI authorship was revealed.
All right.
And compared to when there was no disclosure about the author at all, being told it was AI still resulted in satisfaction being zero point zero 0.09 points lower.
Wow. So people liked the AI response best when they didn't know it was AI or maybe even assumed it was human.
It seems that way. The content might have been slightly preferred, but the knowledge of AI involvement reduced satisfaction.
That creates a real dilemma, doesn't it?
It absolutely does.
Yeah.
It highlights this tension between maybe the objective quality or efficiency of the response and the patient's feelings about how that response was generated.
Yeah, like the transparency issue. Do you tell people, even if it makes them slightly less happy with the message?
Exactly. And that gets
Yeah.
right into the ethics of it. Patient autonomy, the right to know how technology is interacting with your healthcare, those are fundamental principles.
Mhm.
So even if disclosure leads to a small dip in satisfaction scores, the argument for transparency is really strong. It's about trust and empowering the patient.
So pulling this all together, what are the main takeaways here? What should we be thinking about?
I think the big one is that patient experience is absolutely critical as we think about implementing AI in healthcare communication. It's not just about whether the tech works or saves time.
Right. It's how patients feel about it.
Precisely. And this study shows a clear, if complex, picture. AI might draft good, maybe even slightly preferred responses in some ways, but telling patients it's AI matters, and it seems to temper that initial preference.
So there's this balance to be struck.
Yeah.
Efficiency and maybe even quality from AI versus the need for transparency and maintaining that patient trust.
That's the tightrope, yeah. And the study's conclusion leans towards maintaining disclosure.
Even with this late satisfaction hit.
Even with the slight satisfaction hit, the thinking is that upholding patient autonomy and empowerment through transparency is probably the more ethically sound approach in the long run.
Okay, so summing it up, the really surprising thing was patients initially liking AI drafted medical messages a bit more
Right.
until they knew it was AI. Then not quite as much.
You got it. It's a fascinating glimpse into how we react to AI in such a personal space like healthcare.
Definitely food for thought. And, if you found this whole topic of AI in healthcare interesting, especially patient perspectives, you should definitely check out our previous deep dive. We looked into the article, AI Scribe Saved 15,700 Hours, Here's How.
Yes, another angle on AI efficiency in healthcare, looking at how it impacts the clinicians directly.
Exactly. It pairs really well with this discussion.
It does. And, thinking about today's study, it leaves us with a pretty big question to ponder, doesn't it? As AI gets woven more and more into our healthcare conversations, how are we going to manage that balance? The balance between efficiency, what patients prefer moment to moment, and that fundamental right people have to understand how technology is being used in their own care.
Yeah, that's the question we'll all be grappling with, isn't it? Something for everyone to think about.